to this week's 8 o'clock segment on improving healthcare in New Hampshire. My name is Becka and today we get to explore the world of nursing as we discover the importance of good communication skills. One particular story has been brought to our attention here at our station NURS 501. 4 weeks ago, we were contacted by an infuriated woman who had just returned from an appointment from our local Dr. Hamlin Hospital. Unsatisfied by the way she had been treated, this woman gave us a shout-out in hopes that we could further investigate the reason for this unfortunate occurrence. But don't let me tell you about it. I bring you now to our correspondent, Kristen, who is on site at Dr. Hamlin Hospital right here in Durham. Over to you, Kristen.
Good morning. Kristen here, reporting live from Dr. Hamlin Hospital. Today, we bring you a story right here from our own healthcare community, where nurses are working together to work on their communication skills, both alongside with their patients and among their colleagues. Let's take a look at an interview we shot over the past weekend. The patient who contacted our news station, NURS 501, agreed to interview with us and give us the patient's perspective. Good morning, Mrs. P. How are you?
Good, how are you?
Good. It seems like when you were first in the hospital that the nurses broke every rule of communication in the book when it came to talking to you. How did that make you feel?
As a patient, I felt that I was being ignored. I know that nurses are busy, hard workers, but when it came time for them to take care of me, I expected them to effectively listen. Instead, this is what happened.
Mrs. P?
Come in. Hi, Mrs. P. I'm Briana. Nice to meet you.
And I'm Erin, and we're going to be your nurses here at Dr. Hamlin Hospital.
All right, it's nice to meet you girls. My name is
you.
Mrs. P. I have been diagnosed with lung cancer. I just received the results from my biopsy I had a few weeks ago. I don't know much about the disease or how long I have. Do I even have a couple of months?
Of course. You know what? Don't worry about it. No biggie.
Mrs. P, we're going to ask you a few questions in order to help us with your treatment.
All right. Name?
Chelsea Peak,
Birthday?
June 25th, 1941.
Retired?
A little more than usual, I guess, but I mean, I guess that can be because of a lot of things.
Have you eaten today?
Yes.
All right, Mrs. P, tell me what hurts today.
My chest.
So you say you have pain in your chest. Can you describe that pain for me?
It feels as if something's wrong. There's a weight that's pulling down on my chest all the way down through my stomach area.
You know what? Don't even worry about that pain. Once you go through the chemo, there'll be no problems. Come on, Erin. We got a lot to do today.
Mrs. P, are you ready?
Yeah. This is not food. Is this even edible?
Oh, it's time to check your respirations. So, take a deep breath in and out. Good. All right, I'll see you later. Have a good day. That's it? I think Mrs. P is lonely. Maybe we should give her some more attention.
Oh, all right. I'm great with people. You just watch.
Mrs. P?
Hi, Mrs. P.
Hi.
We're going to take your blood pressure today.
Okay.
So, Mrs. P, I have a problem. My boyfriend has been avoiding me for a week. I mean, he's cute and all, but I just don't know what to do.
Well, your blood pressure's kind of high, so we're going to have to monitor that.
Okay.
So, Mrs. P, what do you think I should do?
Stop seeing him?
All right.
Mrs. P? Hey, we're here to teach you the exercises that the physical therapist ordered. I'm going to get you set up, and then Briana's going to teach you how to do them.
Yep.
You know what? I don't feel much like doing these exercises right now. The chemotherapy's been pretty rough this week, and I'd rather just rest.
Oh, no complaining. It's easy.
Maybe for you young things, but not for a 68-year-old like me who's battling cancer.
Oh, come on. You can do them.
All right, well, I'm off. See you, Mrs. P.
All right. You know what, Mrs. P? It's about time that I'm going to be leaving soon, and I just got one more bed bath left before I go on my hot date with John, you know, the one I was talking about. So, how about
You do these because we're pals and you're going to help me out, right?
Sure, but before you run off, could you show me the proper breathing technique one more time? Because I don't think I'm doing it right.
Oh, it's right in here. Just read the papers. You'll be fine.
Mrs. P? How are you today?
I'm okay. I'm just worried that I didn't do my exercises correctly yesterday because Briana ran off before I could ask her to show me the proper breathing technique.
So I'm assuming you're frustrated with Briana's lack of support. I can talk to her about this.
Thanks.
So I will see you later.